Have you ever stopped to consider what your daily rituals, the small, almost unconscious acts of self-care, might be quietly whispering about your deepest well-being? We often think of personal hygiene as a matter of appearance or social grace, a routine we've performed countless times since childhood. But what if I told you that beneath the surface of these everyday habits, a hidden language exists, a silent dialogue between your body and those who understand its subtle cues? What if the way you care for yourself today could be a literal lifeline, revealing dangerous health conditions long before you ever feel a symptom? It's a sobering thought, isn't it? That the very routines we take for granted could be trying to warn us, guiding us towards a healthier path, or, tragically, signaling a silent struggle within. Today we'll embark on a journey of discovery, exploring 7 seemingly innocent personal hygiene habits that healthcare professionals are trained to spot. Habits that can serve as immediate red flags, pointing to underlying health issues that might otherwise remain hidden. We'll look at these not as flaws to be judged, but as vital messages from your body, offering you a chance to listen and respond. Because understanding these whispers and knowing how to respond to them isn't just about preserving your dignity or comfort, it's about safeguarding your independence and adding precious healthy years to your golden age. I once knew a gentleman named Arthur, a spry 78-year-old widower who loved tending his rose garden. Arthur prided himself on his self-sufficiency, believing his regular walks and hearty appetite were all he needed for good health. But during a routine visit, his doctor noticed a few seemingly minor details in Arthur's personal care. These subtle observations, almost imperceptible to Arthur himself, led to a series of tests that uncovered a developing condition, catching it early enough for simple lifestyle changes to make all the difference. Arthur later told me, "I thought I was doing everything right. It's funny how the little things, the ones you barely think about, can hold the biggest clues." Today I want to share with you what those little things are, so you too can be attuned to the unspoken wisdom your body holds. The silent symphony of your mouth, more than just a smile. Let's begin with something we all do, hopefully twice a day, brushing our teeth. When was the last time you truly examined your toothbrush? Is it frayed and worn, looking like it's been through a few too many battles? Are you brushing thoroughly, reaching every nook and cranny? And here's the thought-provoking question. Did you know that the state of your oral health extends far beyond preventing bad breath or cavities? It's a profound connection to your entire cardiovascular system, your cognitive function, and even your body's inflammatory response. Imagine Sylvia, a kind-hearted former librarian in her late 60s, who cherished her quiet mornings with a cup of tea and a good book. She'd noticed her gums sometimes bled when she brushed, but she simply dismissed it as a normal part of getting older. Just another charming aspect of the golden years, she joked to herself. Yet during a checkup, her doctor, observant and thorough, noticed the persistent inflammation. Further investigation revealed a concerning level of inflammation in her heart valves, directly linked to bacteria that had migrated from her mouth. It was a stark reminder that the body works as an interconnected masterpiece, where a seemingly minor issue in one area can echo throughout the whole system. The good news? Sylvia's early detection meant that with focused dental care and some medical adjustments, she could prevent more serious complications. So what can we learn from Sylvia's experience? First, that seemingly trivial worn-out toothbrush, replace it. Every 3 months or sooner if the bristles start to splay. Consider upgrading to an electric toothbrush. Many studies show they can remove significantly more plaque. Commit to brushing for a full 2 minutes, twice a day, maybe even set a timer. And flossing, that often skipped step, is non-negotiable. Every night without exception. And please don't ever skip your regular dental checkups, even if you wear dentures. Dentists check more than just your teeth. They assess the health of your gums, your tongue, and the overall state of your mouth, looking for those silent warning signs. Are your gums bleeding? Do you notice any swelling or tenderness? These are not normal signs of aging. They are signals your body is sending you, asking for your attention. Listen to them. Your future health might just depend on it. The skin you're in, a canvas of inner health. Now let's consider your largest organ, your skin. It's a remarkable protective barrier, but it's also a vast canvas that reflects your internal landscape. Many of us, as we age, might reduce how often we bathe, perhaps feeling less active or worried about drying out our skin. But what if this reduction in bathing frequency could inadvertently hide critical information about your health? Dermatologists and internal medicine specialists often point out that changes in skin condition can be among the earliest indicators of serious internal problems, sometimes even before other noticeable symptoms emerge. Conditions like early-stage diabetes, liver issues, or even cardiac concerns can quietly manifest through subtle shifts in your skin's appearance or texture. Take Clarence, a retired postman who lived in a cozy Michigan home. Clarence, like many of us, believed bathing once a week was plenty, especially during the colder months when his skin felt drier. He'd even say, "Don't want to overdo it or I'll feel like a prune." But during a routine doctor's visit for a minor ailment, his physician, with a keen eye for detail, noticed unusual skin discoloration on Clarence's shins. It wasn't a hygiene issue in itself, but the less frequent bathing had allowed this critical symptom, a silent alarm, to go unnoticed for weeks. Further testing revealed early-stage kidney disease, which thankfully was caught in time for effective management. Clarence's story reminds us that our skin isn't just a covering, it's a living journal documenting our internal health. So what's the prescription here? Establish a consistent bathing schedule, ideally at least 3 times a week, even if your activity level is moderate. Opt for mild, fragrance-free soaps that won't strip your skin of its natural oils. After bathing, gently pat your skin dry, and while it's still slightly damp, apply a good quality moisturizer to lock in hydration. And most importantly, take a moment each time you cleanse to truly examine your skin. Are there any unusual changes in color, perhaps yellowing, graying, or patches of redness that weren't there before? Any new textures like persistent dryness, flakiness, or rough areas? Does your skin itch persistently, or do you notice any new rashes? These aren't necessarily just old skin. They could be your body's way of alerting you to something much more significant happening internally. Don't let these silent warnings go unheard. The wisdom in your nails, tiny windows to your well-being. Now let's turn our attention to something you might trim or polish without a second thought. Your fingernails and toenails. Take a moment right now and truly look at them. Are they neatly trimmed, clean underneath? Are they free from unusual discoloration, thickening, or brittleness? The seemingly simple state of your nails provides an incredibly rich tapestry of clues about your overall health, so much so that doctors consider them immediate checkpoints when evaluating older patients. From anemia to thyroid issues, and even heart disease, changes in your nails can point to over 20 different systemic conditions. Research has shown that in patients over 65, nail abnormalities have frequently led to the diagnosis of previously undetected internal conditions. Consider Beatrice, a spirited woman of 82 who still volunteered at her local community center. Beatrice had noticed her toenails becoming thick and yellowish, almost crumbly, but she simply stopped wearing open-toed shoes and hid them away. Just part of getting old, she'd tell herself with a sigh. It wasn't until foot pain prompted her to see a podiatrist that the true story unfolded. The doctor immediately identified a severe fungal infection that had been allowed to flourish unchecked for so long, it revealed a significantly compromised immune system. This discovery, in turn, led to the diagnosis of a serious underlying condition that required immediate medical attention. Beatrice's initial dismissal of a cosmetic issue had unknowingly delayed a critical health discovery. So what steps should you take today? Trim your nails regularly, straight across, with slightly rounded edges to prevent painful ingrown nails. Keep them clean and dry. When it comes to your feet, wear breathable footwear and change your socks daily. And critically, never ever ignore changes in nail color, texture, or thickness. Are your nails brittle, perhaps breaking easily? Have they turned yellow, blue, or even black? Are they unusually thickened or ridged? These aren't inevitable consequences of passing years. They are your body attempting to communicate something important. Will you listen before it's too late? The hidden burden, addressing incontinence with dignity. This next area can be one of the most challenging to discuss, often shrouded in embarrassment and silence. Incontinence. It's a remarkably common issue, affecting over half of all seniors to some degree, yet it's often hidden away, leading to a silent struggle. And this is where the danger truly lies. Urologists report that unaddressed incontinence can lead to dangerous skin infections, an increased risk of falls, and significant social isolation. But perhaps most critically, it can mask serious underlying conditions like bladder or prostate cancer. Research indicates that seniors who proactively manage incontinence issues experience significantly fewer complications than those who attempt to hide the problem. Think of Douglas, a retired accountant of 73 from sunny Arizona. Douglas was a private man, and the occasional bladder leakage he experienced became his secret. He'd use paper towels, change clothes frequently, and meticulously plan his outings around bathroom access, believing he was managing the problem discreetly. It wasn't until he developed painful skin sores that he finally, reluctantly sought help. The doctors were able to address the sores, but in doing so, they uncovered an advanced prostate condition that could have been treated months earlier, with far better outcomes. "My pride almost cost me my life," Douglas admitted, his voice heavy with regret. "I wish I had talked to my doctor at the first sign of a problem instead of trying to hide it." Douglas's experience offers a profound lesson. Never be embarrassed to discuss bladder issues with your doctor. They are trained professionals who see this every single day and understand the delicate nature of the topic. If you are experiencing any form of incontinence, use proper absorbent products designed specifically for this purpose, rather than makeshift solutions. Change them promptly when wet, and follow a diligent cleansing routine to prevent skin breakdown. Most importantly, recognize that incontinence is not a normal or inevitable part of aging. It is frequently a symptom, a signal that something needs medical attention. Are you experiencing occasional leakage? Are you finding yourself planning your entire day around bathroom availability, using makeshift protection? These are not just inconveniences, they are symptoms that require professional guidance. Your health, and quite possibly your quality of life, may depend on you taking that courageous first step. The delicate world within your ears, protecting a precious sense. Now let's consider your ears. What's your ear cleaning routine? Be honest with yourself. Are you reaching for cotton swabs and inserting them deep into your ear canal? If so, you might be making a common yet dangerous mistake that many seniors unwittingly repeat every day. Many older adults are inadvertently damaging their delicate hearing mechanisms and missing crucial signs of serious infection due to improper ear cleaning practices. Ear, nose, and throat specialists consistently warn that inserting foreign objects deep into the ear canal can push wax further in, leading to impaction, temporary hearing loss, and even, as in the case of a punctured eardrum, severe permanent damage. Furthermore, these improper methods can obscure symptoms of potentially dangerous infections that could otherwise be easily treated. Let me introduce you to Patricia, a vibrant 71-year-old retired librarian from Washington. Patricia had always used cotton swabs to clean deep inside her ears, believing it was the proper way to ensure good hygiene. "My mother always did it this way," she'd explain, until one day, a sharp pain followed by a sudden decline in hearing revealed she had punctured her eardrum. This led to a severe infection that spread to nearby tissue, requiring emergency treatment and resulting in permanent hearing damage that could have been entirely avoided. Patricia's story is a powerful reminder that sometimes, the routines we've always followed can harbor hidden risks. What's the correct approach to ear hygiene? Remember this simple golden rule. Never insert anything smaller than your elbow into your ear canal. That means no cotton swabs, no bobby pins, no twisted tissues. Clean only the outer ear with a warm, damp washcloth. If you feel you have excessive wax buildup, or if your ears feel blocked or itchy, use over-the-counter ear drops specifically designed to soften wax, following the package directions precisely. And see a doctor immediately if you experience pain, discharge, or any changes in your hearing. Are your ears constantly itchy, feeling full or blocked? Are you experiencing unexplained changes in your hearing? Do not attempt to resolve these problems yourself. They require professional medical attention. Your hearing is a precious gift. Protect it with proper care. The foundations of your mobility. Paying attention to your feet. Next, let's examine the very foundations of your mobility and independence, your feet. When was the last time you truly looked at them? Not just a fleeting glance, but a thorough inspection. The spaces between your toes, your heels, the soles of your feet. Your feet are not merely for walking. They contain vital clues about your circulatory and nervous system that doctors often check first, especially in older patients. Podiatrists specializing in geriatric care emphasize that seemingly minor foot hygiene issues can reveal the first subtle signs of diabetes, neuropathy, nerve damage, and vascular disease. In fact, studies show that in patients over 65, diligent foot care and regular inspection could prevent a staggering 85% of diabetes-related amputations. That's not a typo, 85%. Imagine the lives saved, the independence preserved by simply paying attention to our feet. Consider Raymond, a 76-year-old retired factory worker from Illinois. Raymond had noticed his feet felt perpetually dry, and he'd have minor cuts or cracks that seemed to take an unusually long time to heal. "My feet have been looking rough for years," he'd admit, shrugging it off as a consequence of a lifetime of hard work. But when his doctor happened to notice the persistent dryness and slow-healing cuts during a routine exam, he immediately ordered a diabetes test. Raymond was diagnosed with early-stage diabetes, catching the disease at a point where lifestyle changes could still make a significant difference. "If my doctor hadn't checked my feet," Raymond told me, his voice filled with gratitude, "I might have gone years without knowing I had diabetes. By then, the damage would have been severe." What can you do starting today? Wash and thoroughly dry your feet daily, paying special attention to the spaces between your toes where fungus loves to hide. Inspect them regularly for any cuts, sores, blisters, or changes in color or temperature. Wear clean, dry socks made of natural fibers or moisture-wicking materials. Apply moisturizer to dry areas, but avoid applying it between your toes. And never ever ignore pain, numbness, tingling, or wounds that don't heal. See a medical professional immediately if you notice these. Are your feet dry and cracked? Do you notice any cuts that aren't healing properly? Any unusual discoloration, swelling, or loss of feeling? These aren't just cosmetic issues, they could be early warning signs of serious conditions that need immediate attention. Your feet are your anchors, treat them with the care they deserve. The unseen effects, medication, and personal care. Finally, let's delve into an area that might surprise you. How the medications keeping you healthy might also be subtly influencing your personal hygiene, signaling potential issues that need attention. Are you taking multiple medications? Have you noticed any changes in your body odor, your sweating patterns, or how dry your mouth feels since starting new prescriptions? What many don't realize is that some commonly prescribed medications can cause side effects that manifest as changes in hygiene needs, and these changes can sometimes indicate potential toxicity or adverse drug reactions. Pharmacologists have documented how certain medications can cause dry mouth, excessive sweating, or alterations in body odor, and these seemingly minor shifts can be the earliest indicators of more serious symptoms about to emerge. It's been found that a significant percentage of adverse drug reactions in seniors first present as changes in personal hygiene needs before more serious symptoms become apparent. Think about Barbara, a retired nurse from Florida, in her late 60s. Barbara's family began to comment on an unusual body odor, which they mistakenly attributed to a decline in her personal hygiene. Barbara was perplexed. She was showering regularly and using deodorant diligently. It wasn't until her geriatrician, with a deep understanding of medication side effects, recognized the peculiar odor as a sign of medication toxicity that was slowly damaging her liver. "I was showering regularly and using deodorant," Barbara explained, her voice tinged with frustration. "I had no idea the smell was coming from inside my body, not from lack of cleanliness." Her experience highlights the critical need for awareness and open communication with your doctor. What can you do to protect yourself? Become an active observer of your own body. If you start new medications, keep a simple journal for a few weeks, noting any changes in body odor, sweating patterns, mouth dryness, or skin changes. Stay properly hydrated unless your doctor has specifically instructed you to limit fluids. Report any unusual sweating or persistent odor changes to your doctor immediately, as these could indicate dangerous drug interactions or side effects. And crucially, never adjust dosages or stop taking medications without first consulting your doctor, even if you suspect they are causing hygiene issues. Have you noticed an unusual body odor despite regular bathing? Excessive sweating? Extreme mouth dryness that feels different than before? Don't simply attribute these changes to normal aging. They could be warning you of potentially life-threatening medication effects that need immediate attention. A call to vigilance and well-being. We've journeyed through 7 often overlooked aspects of personal hygiene, revealing how each can serve as a vital messenger from your body. From the silent symphony of your mouth to the hidden burdens of incontinence, and from the wisdom in your nails to the subtle whispers of your medication, each facet offers a unique lens through which to view your overall health. By paying attention to these seemingly small details, by understanding their deeper meaning, you gain a powerful tool for proactive health management. You can prevent serious health problems, maintain your dignity and independence, and most importantly, potentially add years of vibrant, healthy life to your journey. Remember, proper hygiene isn't just about appearance or social courtesy. It's a fundamental pillar of maintaining your health as you gracefully navigate the landscape of aging. These simple changes and heightened awareness could literally save your life or profoundly improve your quality of life. The knowledge you've gained today isn't just information. It's an invitation to listen more closely to your body, to become its attentive guardian. If stories like this speak to you, or if you believe more people should hear these gentle yet powerful insights, consider subscribing to Psychology and Wisdom of Aging. It helps more than you might think, allowing us to share more valuable perspectives on living fully in your golden years. And please share this video with your loved ones, especially those over 60. This knowledge, these unseen whispers, could truly save their lives. Because when we listen to our bodies, we empower ourselves to live with greater health, dignity, and wisdom.